what worries you both? Michael, I'm going to start with you, but because we do know there will be other public health crises, maybe it's the resurgence of a disease we've already vanquished. Maybe it's a whole new, I lie awake some nights and worry about the permafrost melting and what the pathogens that are going to be released out of there. It could be a whole new pandemic. Given where we are with our lack of kind of agreement on this public behavior around these issues, how concerning is that?
I'm more concerned than I ever have been, because not only are the things that we've talked about, but we also have what used to be kind of the global beacon of public health in the United States be systematically dismantled, and not just dismantled, but being replaced by conspiracy theorists. It's one thing to say we're not going to have a website anymore on vaccine information, but they've taken it one step further and said we're going to have a website on vaccine misinformation,
Right.
and sell it as the truth. And it's horrifying to me when I look at what the CDC and others were involved in over the last 30 years, and that's vanishing. And I don't know who's moving in to take that spot. And so H5N1 is just a couple mutations away from jumping into humans. And when it does that, we'll hear about it in a matter of 24 hours. Like, it'll be that quick. And where's the CDC in any of that? Like, I that really horrifies me.
Yeah, I feel very much the same. It's with what's we've already talked about with social media, and then at the same time seeing what's happening in the US with these devastating cuts to the National Institutes of Health. Even if we could turn back the clock and change everything right now, we're still going to see decades of impact to research, to learning about future diseases. They have stopped participating in influenza vaccine planning, and so they were a major source of information about what strains were going around, and suddenly that information's not coming. They made up 20% of the budget for the World Health Organization. Imagine suddenly that organization losing a fifth of their budget. They're doing critical work to prevent Ebola, to prevent so many diseases that cause harm all around the world. And to see that disappear, we're looking at decades of harm from what's going on there, because they did, to give them credit, they over contributed to the world's public health science, public health awareness, and we've lost some really serious, really critical health infrastructure, information, and to be replaced with fear-mongering, to be replaced with further attempts to undermine trust in institutions, that will seep over the border. We saw a reaction in the last federal election in Canada, but I think it's realistic to see that this is going to seep into Canada slowly, even though we had this temporary pushback, that we're going to start to see these trends replicate in Canada because we are so deeply in their ecosystem.
This point about kind of the loss of the research ecosystem, I think, is so important and well made. We can't, of course, because we're small, even if we devoted all the resources we have available to it, we can't compete with the level of funding the U.S. has done. They've been such a major player in this. But couldn't Canada and the EU and some other nations come together to, shouldn't we be doing that?
And I actually think that will happen. I think that, we've been living, 80 years with the U.S. I mean, the reason the U.S. was in that position as the world's steward, so to speak, is because they wanted that position. I mean, they intentionally went out and funded these things and took these positions to be the number one country in the world. If they're not going to do that anymore, other people are going to have to do it.